discussions happen about what happens on the margins, and that's that little white corner down the end. Stabilizers in the frontal and transverse plane, or the adductors and the glute medius, right? Keeping you centered. It's just because when it comes to coaching and selecting exercises, coaching them into a position that gets them to better utilize their hamstrings and glutes and obliques. I got this anatomy presentation for you. I hope you guys like it. So a little bit about me if you don't actually, oh great, the clicker's not working, perfect. If you don't know me, I've worked here for probably about 13 years. I work as a strength and conditioning coach, personal trainer, massage therapist. I have a massage therapy business right in here where you guys were coming in. Also an educator with certified functional strength coach. Thrive kind of helped give me my start doing education for sure. And I have a book by the same name called Functional Training Anatomy. So this is kind of a book that's going to go over our overall training philosophy from an anatomical standpoint, really a functional anatomy standpoint, to kind of give you an understanding about maybe why we select exercises the way we do, why we program and coach things the way that we do. And so I'm going to try to hit some of the big rocks from the book in that process, all right? And if you have any questions as we go, just throw your hand up. It's a lot easier if we just have a conversation, one for everybody here, because if you have a question, someone else here probably has the same question as you, so don't be shy to ask, all right? Let's work, come on. There we go. All right, so let's kind of rewind a little bit and kind of give you a little background about me and my introduction to the term functional training. So about 14, 15 years ago, I was working at a Gold's Gym in Maynard, Massachusetts, where I grew up. Typical like meathead haven, as you would imagine. I was 19 years old, pretty much just working there because I got a free membership. So I could work out for free, I could talk to girls. It's a pretty good gig for a 19-year-old guy. And just like anybody else at that age, the evolution's pretty similar. I picked my workout out by opening up Muscle and Fitness and just doing whatever like Jay Cutler's chest workout was at the time. Yeah, exactly. I mean, it was probably Bruce has definitely done it. And so I didn't really know that much, but I just wanted to work hard. And there was this guy working there, his name was Clark Evans, and he was kind of a trainer at will, a private contractor working out. And I look over and he's like doing single leg deadlifts, he's doing hang cleans, he's doing single leg squats. And I'm like, what? This guy doesn't know what he's doing. He's not using the pec deck. And so I worked out with him one day and he's like, you want to come work out with me? And I got crushed. Like I couldn't do single leg squats. I couldn't do hurdle hops. Pretty much anything on one leg, I was useless, right? And he crushed me. So I had a conversation with him and I said, where did you learn all this? And he said, well, I just did this mentorship with this guy, Mike Boyle. He's the Boston University strength coach. Like, you should really look into it. And again, I'm like, picture me. I don't even know who Mike is. I grew up about 40 minutes away from here. He said, you should look into it. So I applied for an internship. That was in 2007 going into 2008. And when I stepped in here for the first time, like this was a whole new world to me. Like my introduction to strength and conditioning was this place. So I was very fortunate in that. But that changed my entire life in my perception of what training was and what training could be. And in writing the book with Mary Kate Fight in Human Kinetics, I wanted to kind of give people that initial introduction. I hope someone opens that book or hears this presentation and kind of changes their perception of what they think about training and how to look at exercise selection, how to look at programming and coaching. And I hope kind of in this experience, maybe I can give that to all of you here, okay? So functional training is obviously a big buzzword, positively and negatively in the fitness industry, right? And anytime you say it, immediately people get some connotation in their mind of what that means, some sort of image, right? And it could probably be any of these three things, right? And in my mind, functional training is definitely specific to the task at hand or the intended goal. But many people might say, oh yeah, that's standing on a wobbly board or doing twisty cable exercises. Or you have, the powerlifting traditionalist who says, like, I have to get up off the toilet so a back squat's functional. And so maybe in my mind, I'd like to think that we settle somewhere in between. And so I want to be able to provide a good definition for what functional training means, first and foremost, so then we can understand functional anatomy behind that. So if there's one word to sum up functional training, I would say it's purposeful training. It's thoughtful exercise selection to get someone to a certain goal. So like I had to be forced to write a definition in writing a book, so that was helpful. And so what I said was functional training means we are purposefully selecting exercises to improve a specific outcome and basing those selections on the structure and function of the human body. It doesn't mean there's a specific tool that you're going to use. It doesn't mean that there's a specific rep scheme that you're going to use. It doesn't mean there's specific muscles necessarily that you're targeting, because all of it is in context of whatever that client's goal is. And I think often, especially now where information overload is an issue, because you can continually find any definition or any answer to any training question that you have on the internet, that it gets murkier and murkier for how to define these things. But it's important for all of you to realize, because you actually train people, that it all goes back to the client and what the client wants and what the client gets. Everything that we use in this facility is a tool simply to get someone where we need them to go, right? So there isn't a preferred tool, there isn't a preferred method, there's whatever the client's goals are. And we'll talk about building programs off of that. So, you know, for many of us, maybe a lot of us would probably look at this and say, that's useless, right? I probably wouldn't have a client do, I don't know, whatever, that's just wrong arm, wrong leg march thing on the ball. However, maybe that client is a circus performer. Probably a slim chance, but something to take into consideration. That would be a pretty specific intervention for that individual. Now, the majority of people that come into your gym or your facility probably don't have that as their listed profession. An accountant, probably not a circus performer, right? Similar thought process here though, right? The issue with strength and conditioning as a whole is that we're extremely influenced by strength sports, right? Powerlifting, Olympic lifting, strongman, bodybuilding. These are the things that typically get people into it because they're exciting. But the intended outcome in any of these activities is to lift more weight in that activity. So this is functional training for powerlifting. It's very functional. It's 100% carryover. So again, if you're training a client whose intended stated goal is I would like to back squat more, probably a really good tool, probably a really good selection. However, I don't know if you saw a lot of people working out here today. We don't have a lot of guys like this walking around here who are going to compete in a powerlifting meet next week, right? So again, although we might have preferential exercise selection due to our own wants, our own needs, our own history, that might not necessarily have the most carryover to the average individual athlete person that you see in your gym on a daily basis, and we want to keep that in mind. This looks a lot more like the average individual that walks into here and probably comes to your gym. Look, people who are learning, beginners, like this gentleman on the left who's just learning how to front squat with an empty bar, that's probably good exercise selection for someone who's a beginner. College athlete in the middle, developing, he's a college baseball player, developing strength and carryover for his sport and resiliency. And then a couple of my personal training clients all the way on the right. Sharon's about 61, he's 75. My exercise selection to them is going to be a little different. And the reason I show them is I would venture to guess that if we looked at the bell curve, the 80% that's in the middle there, your clientele looks like something like this, right? And so if we go again back to the definition of what functional training means, it's purposeful exercise selection based on the client's intended goal and structure and function of the human body. And we're all working with the same body, and the majority of people that come to train with us probably have similar goals, right? And what happens lots of times with discussions on the internet and argument on the internet is that we typically get caught up in arguing about the margins, not necessarily the things that happen down the middle, right? So we have this quote from Jorge Carr where he says, your sport's not different, you just think it is. And there's a lot of sports performance coaches that think I need X exercise or I need X type of programming because I work with X sport. But again, the majority of people you work with have a very low training age, whether that's a personal training client or an athlete. They don't have a lot of experience, nor do they have a lot of time to dedicate to training. And so the fact of the matter is, most of the training is going to be pretty general. And sometimes that's hard for sports performance coaches and personal trainers to accept because I think intrinsically it makes them feel like they're not as valuable. But it makes you very valuable if you can deliver a very good product, a general product consistently. So again, if we think about general versus specific goals, again, let's think about those three clients we just talked about in my picture there. General population adult clients, low training age youth athletes, and team sport athletes. That specific training outcome that we referenced in the definition of what functional training is pretty general, right? And that's okay. But we have to wrap our head around the fact that the exercise selection is going to be pretty similar across those three. Think 80-20. We're all working towards the same body to get to fairly similar outcomes, albeit at different volumes and different intensities for different clients. right? So again, like I said, most of the time the arguments and the discussions happen about what happens on the margins, and that's that little white corner down the end. But the 80% for every client that comes in, one, they just generally want to feel better when they get up in the morning. They don't want to hurt. They don't want to be sore. They don't want to be stiff. And in that means improving movement quality, increasing their general power output, both upper body and lower body, increasing generalized strength, improving speed, improve cardiovascular fitness, and as a result, hopefully, if it's someone with a body composition goal, lose some weight. But however, lots of times when we hear people detract from maybe what we might define as functional training or our exercise selection, it's because they're referencing things like specific balance training, like the woman on the ball, working at extreme mobility examples and ranges of motion, working around anatomical abnormalities or injuries, unique rehab situations, or skill-specific training or max effort bilateral strength. And those things all might come into play with specific clientele, but it's usually on the margins. It's usually in that 10, 20% of the people that you see. And typically when we're programming for scalability, like it's probably been a popular term of what we've been talking about with this group, we want to think about what 80% of the people need. And again, most of the athletes in here, if you look at an athlete program, if you look at an adult program, the structure isn't really going to change. Volumes and intensities and exercise progressions might change, but the recipe doesn't really falter. We always say training is like a recipe, not a menu, right? Can't pick what you want. The proportions might change, but the order and the selection of what we use is going to be pretty similar, and it's going to look something like this. And so, I was one slide ahead with my reference. So again, most of the people want to have a program that has mobility training to optimize tissue extensibility and joint health. Movement preparation drills to improve movement quality and efficiency. Unilateral, bilateral, multi-directional power exercises, full body strength, as well as energy system development for the specific needs of that client's health or that athlete's sport of choice. Okay? So if we have a definition of what functional training is, now we have to have a definition of what functional anatomy actually is. Okay? What's the difference between traditional anatomy and why does that matter to us, right? So if you think about gross anatomy, what you probably might have slept through in high school, very valuable, right? It teaches you the basics. It teaches you origins and insertions. Where do muscles attach? It teaches you pronation. Where do the angles and what are the shapes of the muscles look like? What are they innervated by? The articulation, what are they attached to as far as ligaments and tendons and other muscles go? And then relative position and size. A lot of pictures like this where you had to memorize probably and fill out a test where you had to write in all the muscles, right? Really valuable to understand the basic roadmap of what your body looks like, right? That's a good place to start. However, when we start to get towards exercise selection and carry over to what we're doing in the gym, we have to think about 3 other variables to make all of that anatomy come alive. Because how you function on a table and what those muscles do when the body's laying flat and supine is going to be a lot different than when somebody's on one leg and they're standing and they're moving dynamically. And so to help us make better training decisions, we want to take these 3 things into consideration. So we have to understand muscle actions, we have to understand planes of motion, and then we have to understand relative positions and how that dictates muscle function as a whole. So what do I mean by that? So actions, how are the muscles acting? Are they acting concentrically, eccentrically, or isometrically? Which muscles are antagonists and agonists and synergists? Which planes are they moving in? What planes are the muscles working in, and what plane is the overall motion that we're training moving in? And then how does position of the body affect how those muscles work? Because it's important to realize the muscles are generally just slaves to the positions the joints put them in. They can only function if we put them in good positions to do so. And that's going to dictate how we coach certain exercises, right? So let's take single leg squat into example to get started. So during this goal activity, what muscle's the agonist? Which one's the prime mover? Quadricep, at least concentrically there. Antagonist would be the hamstring as they're going up, right? Stabilizers in the frontal and transverse plane are the adductors and the glute medius, right? Keeping you centered. And then the glute max would be a synergist to help you finish the movement, right? So basic understanding of those things is going to be really helpful. Because then if we understand what happens in their goal activity, their sport, the actions that we're trying to improve, then we can have better exercise selection from there. Again, understanding which muscles are shortening, which ones are lengthening, and which ones are staying relatively isometric. Stabilizers are relatively going to be isometric or eccentrically functioning, like the glute med and the adductor, where your agonist is typically going to be concentric and your antagonist would be eccentric. That might be a simplification, but it's a good place to start. And then again, planes of movement, which muscles work where, right? Because sports isn't just a sagittal plane activity, right? It's a frontal and transverse plane activity that we have to take into consideration. And then talking about positions and orientations, realize again, joints dictate muscle function. Overly lengthened or overly shortened muscles don't function optimally, right? That makes a lot of sense to you. Where are you going to be stronger? Are you going to be stronger here, or are you going to be stronger here, right? When things are really eccentrically loaded, it's not a very good link-tension relationship for muscles to work, right? And so a good example I always use, this is kind of where everything starts from the inside out, is you have this, what they call like an open scissor or extended posture here, not inherently bad, but we have to understand how that might affect how all of those articulating muscles work, right? If my rib cage is relatively elevated and externally rotated, and my pelvis is relatively anteriorly tilted and externally rotated, you have a lot of eccentric load in your abdomen, right? You can't really flex your abs very well, right? Similarly, you can't really flex your glutes well. Actually, let's do this. Everybody stand up for a second. Here's a good example. All right, everybody kind of get an extended posture like this, right? Booty out. Now try to squeeze your booty. Try to squeeze your butt. How are those glutes working? Right, now take an exhale, relatively tuck your pelvis down, bring your ribs down. Now squeeze your butt. How do glutes work? It's different, right? Yeah, you guys can say, I just got to get you up for a second, right? Right, so now muscles are going to work relative to the positions that we put them in. So understanding how we coach exercises makes a really big difference because the effectiveness of what we program can change, right? So kind of going from there, talking about planar movement, something that can be confusing sometimes in the weight room is when you look at the majority of things that we do in the weight room, they look like they're sagittally plane dominant, right? You're usually moving up and down, forwards, backwards. And I know Mike talked about single leg training a little bit today, so he might have touched on this, but it's important to differentiate between what we call global planar movement, the overall net movement of the exercise, versus the local planar forces that occurred during the exercise, right? So if I look at this rear foot elevated split squat, this nice grainy photo, Sean probably hates that, is this rear foot elevated split squat, if you watch him do it, the majority of the motion would be in what? The sagittal plane, right? But what does he need to do to not fall over while he does it, right? Have you ever seen someone try to do a split squat for the first time? What does it look like? They're like, there's a lot of this. There's a lot of frontal plane and transverse plane movement for a reason, because they don't have the ability to use their frontal plane and transverse plane muscles, obliques, adductors, glute med, to keep them in position. So those muscles are working. They're negating those frontal and transverse plane forces so you can produce force in the sagittal plane. And that inherently is the value of doing unilateral-based exercise, because if you can successfully load and complete the movement to the form that we asked you to, then we're getting the stimulation, the isometric and eccentric function of those multiplanar muscles. Now, we realize the majority of explosive force production that we see in sports is usually sagittally plane dominant, but doing that in an offset posture, like unilateral posture, is highly dependent on those other muscles to be able to keep us going where we need to go. And those things like those anterior and posterior oblique systems, that's how we're able to transfer force in the frontal and transverse plane. It's how we're able to take power from our rear hip and transfer it across our body into our hands to hit a baseball or to hit a golf ball so that we can move powerfully in multiple planes using those sagittal plane muscles to transfer it through those frontal and transverse plane muscles and produce force. And that's really the power of sports, right? And so when it comes to selecting exercises from a functional anatomical standpoint, the 4 questions I usually ask myself when building a program are these. They're a good way to audit yourself on your exercise selection. Number 1, am I loading the appropriate tissues, right? Am I targeting the tissues I need to make that person powerful, more durable, more resilient? Am I loading the appropriate joint positions, the ones that we see in their life or the ones that we see in their sport? Am I addressing the specific planes and actions of whatever that intended goal is, right? So we want to see carryover. And can I load to the volume, intensity, and speed that I want? Because sometimes you can check the first 3 boxes with like low-level motor control type drills, but if they can't get strong enough or powerful enough or at the speed that they want, it's not very valuable, right? So we need to be able to check all 4 if we're thinking about resiliency and performance. You can't just have 1 or 2. So now, in kind of with that brief introduction, I want to go into practical application, using these ideas, talking about some of the major major things that we think about in programming, how can we reference them to understand why we choose the exercises that we choose? So I want to go through a few lower body examples, upper body and trunk-based examples as to why we select the exercises that we do. So let's talk about hamstring strains first. Probably it is the most common non-contact soft tissue injury in all sports. I mean, if you watch NFL football, you'll see a few every single weekend. Why do they happen? What happens? And what can we think about from a injury exercise selection standpoint to help that? So let's talk about what happens, what a hamstring actually does, and how hamstrings function in sport. So what do hamstrings do? Number one, they concentrically assist hip extension, right? So when my foot strikes the ground, my hamstring and my glute, bring that hip backwards. It eccentrically decelerates knee extension. So if my left leg's coming through and I'm running and that leg's coming forward, putting the brakes on my tibia before that foot hits the ground. And number three, it isometrically helps control position of the pelvis. Isometric and eccentrically moves it in the sagittal plane. Notice I didn't really reference concentric knee flexion at all. Now, in a seated hamstring curl or a prone hamstring curl, it works really a lot as a concentric knee flexor. But when they actually look at what happens during running, the majority of knee flexion that happens is actually from intersegmental dynamics, from the leg swinging through. Now, there is a little bit of concentric knee flexion, but it's the least of the four activities that it does. However, what are most of the exercise selections that we think of when we think about hamstring development? You see a prone leg curl, you see a seated leg curl, where you don't think about hip extension, you don't think about knee extension, you don't think about pelvic positioning. And so, again, if that's what the hamstrings do, we need to select exercises that do those things and check those boxes effectively. So what do we know about hamstring strains from the research? The biceps femoris is the most commonly injured of the four, right? So you have semimembranous, semitendinous, and then the long and short head of the biceps femoris. So the long head of the biceps femoris is the most commonly injured of the four, by a long shot. It's something like 70-something% compared to the others. Most commonly, almost always injured during the terminal swing phase of gait. So that would be either number 1 or number 7, like right before heel contact. When that foot's coming down, it's usually right about here that the hamstring blows up. Okay? That's because at that point, there's high levels of eccentric decelerating of the lower leg because you're coming forward. Stabilization of the pelvis right before a foot strike because you're trying to get your pelvis under you to extend. And then right after that, high velocity hip extension. So I always say, like, if I had to coach a group, if I had to coach all of you guys, right, after this, and I was supposed to have myself and 2 other coaches show up to help me, and I have to do it by myself, by the end of the day, I'm going to be pissed off, I'm going to be grumpy, I'm going to be tired because I had to do all the work on my own. That's generally a hamstring, right? Because if you should have some obliques helping you control the sagittal plane. You should have a glute helping you extend the hip back, and then hopefully, then they can also just focus on slowing down that lower leg, right? When the glutes don't work well as a hip extender, when the obliques aren't doing their job to control the pelvis, the hamstring just gets a lot of eccentric strain and then also has to work as a hip extender very, very quickly afterwards. And generally that's what you see. And when they look at people who suffer from hamstring strains, and typically some of these cool studies, they follow a whole team over the course of the season and take a bunch of measurements and look at the people who had hamstring strains compared to the controls. And what they tend to find, the people who suffer from hamstring strains present with increased hip flexion angle, aka increased anterior tilt relative to their femur. They have increased medial knee rotations because there's more eccentric tone attaching to the hamstring, and then reduced biceps femoris activity when compared to the glute on the same side, right? And the reason that hamstring doesn't work well is because it's being pulled taut the whole time. What do we know about people who always say they have tight hamstrings? They don't normally have a short hamstring. They have an eccentrically loaded hamstring all the time. It never takes a break. And so when you see people who typically suffer from that, you can check those boxes. I've rehabbed hundreds of hamstrings in my office right there, and unanimously you can always run right down the list and see those things preceding or showing up after the fact. So, yep. Yeah, we got a band. We got like a super band somewhere. I can kind of just tell you anyway. So typically, we got your hamstring, right, attached down the tibia, attaches to the bottom of the pelvis, right? And what we tend to see when people say like, oh, my hamstring's always tight, I got to stretch it. What happens is if you think your hamstring attaches to the bottom of the pelvis, right? Is that perceived tightness or real tightness? It's eccentric tension. right? So if you think if my hamstring attaches here and my pelvis is like this, it's being lengthened. It's not that it's short. They have the mechanical perception in their head that is a short hamstring. It's actually eccentrically loaded all the time, so there's always a stretch going through it. It's like if I took a super band and I pulled it. The second you get them to understand how to get their pelvis under them and their ribs down, you take a little bit of mechanical and eccentric tone out of that muscle. So like I was talking about, you actually led me right into my next slide perfectly, is if you look at that positioning that a lot of the most athletic people you know, that's the catch-22. The things that make us powerful, explosive, and fast are the things that put us into this relative position, right? When we trap bar, we jump, we swing, we sprint, and these things are all good. We just can't live there, right? And so this is my little hamstring, and my little hamstring attaches to the bottom of my pelvis, and I'm like this. So a lot of eccentric tone there. If I can teach someone how to use their obliques and just put a little bit out, all of a sudden their hip flexion improves hugely, their hip extension improves hugely, and then they can actually use their glutes, right? And so, there we go. Eccentrically loaded hamstrings, glutes, and abdominals are in poor positions to contract and produce force. Concentrically loaded hip flexors and lumbar paraspinals typically produce with increased tone. So those of them that being like, oh, my hip flexor feels tight, my low back feels tight. The people who are always like, doing this, like that's a sign to me that I'm like, oh, okay, we got something to deal with. The person who always does that stretch. So when I reference this because when it comes to coaching and selecting exercises, coaching them into a position that gets them to better utilize their hamstrings and glutes and obliques are going to have greater carryover to sport performance, right? So again, here we go. Eccentrically and concentrically loaded. If we can even out that relationship where those two lines are parallel instead of open to the front, things work a lot better, right? So not all leg curls are created equal, right? So you see this typical prone leg curl on the left. Then we're going to show Brendan here. Oh, I'm not going to show Brendan apparently. And then we'll show Brendan here. Tell me what the difference is between these two leg curls, right? What does he get here that she doesn't get on the left? He gets hip extension. So that's one of those things we had to check, one of the boxes, right? Also, if he's in a nice straight line, he's not sticking his belly to the ceiling, he's using his obliques to control the pelvic position. So that's 2 boxes. Now, once he adds the slide board in, the valve slides in, he's going to get eccentric tone and eccentric loading in the hamstrings. So you have to take into consideration all the things that it does, not just the number one thing in the textbook, which is typically knee flexion, right? So he has hip extension, check with the glutes. Controlling his posture in that position, sagittal control of the pelvis, and then eccentrically loading the hamstrings. And then once they can do that, then we can start to add the concentric portion in, but he has to check those basic boxes first. And so again, thinking about what is a better selection. Here, single leg deadlift. What do we get? Very high eccentric loading in the hamstrings. You can load these up really, really heavy. Like we have people up to almost 300 pounds, right? Rapid hip extension, okay? And if you're controlling them not to do this, positioning of the pelvis. So we want to check those boxes. What were the questions we asked? Are we loading the joint positions? Are we loading the velocity and load that we want? I think that stance position right here looks a lot like stance phase when you're sprinting, right? I'm also getting rapid hip extension, high loading through the tissues. So I always want to continue to ask myself those questions, right? So again, just like I said, that's the value to me in selecting these exercises because of the things you get. It's not just a hamstring exercise. It's a hip extension exercise, and it's an abdominal exercise if you do it correctly, right? And then the one last box we had to check, are we moving at the velocity that we want? They always, vaccines are a popular topic now, right? So they always say sprinting is the most valuable vaccine you have against hamstring strains. One, because it's the most specific thing you can do. They usually tear or strain a hamstring when they're sprinting, right? So what we have to do is like, I can't check all those answers that I said about loading at velocity, speed, intensity, unless I also run. And one of the reasons I'm convinced we don't see hamstring strains here, like from our athletes in-house ever, where did the cursor go? Oh, there it is. Is because we have them do time sprints like this every day they come in addition to doing the leg curls, in addition to doing the bridging, in addition to doing single leg deadlifts. Because what happens is typically when you see these guys get hurt in the NFL is they practice at about 80% speed all off season, and then they run at 105% when they get to a game, and what do you think is going to happen? The wheels come off. Right? You have to introduce them to the velocities of sport because the high levels, there's nothing you can do in the weight room that's going to replicate the speed of movement that they get when they sprint. So if you're working with athletes in a rehab situation or a preventative situation, running is probably going to be your most valuable intervention that you have, right? And so we're running time sprints like this on a daily basis with them to continue to try to push the velocity, right? So again, check the boxes. Am I doing all those things? Am I loading the appropriate tissues? Yes. Am I loading the appropriate joint positions? I was going to say, this looks a lot like that to me, right? Am I addressing the specific planes and actions? Yeah, multiplanar, or probably check boxes in every single plane, at least on single leg deadlift, on bridge, and on running. And can we load the volume, intensity, speed we want? Yes. Again, as opposed to something that might not carry over, like an isolated leg curl machine. Now, let's keep going. I think Mike covered some of this today. We'll keep it going. Why do we train on one leg? Okay, so the other hot topic for lower body. Why do we prioritize unilateral training more than bilateral training? And it's not to say that we don't do bilateral exercise. You probably saw a lot of people deadlifting and squatting out there today, right, when you poked your head around. But why do we value it? I mean, because everything we do is on one leg. Again, unless you're a rower, unless you're doing crew, the majority of the time you play in any of your sports is going to be unilateral, right? And so we need to select exercises that, again, answer those questions and check those boxes so we can address like lateral subsystem, your glute, your adductor, your glute medius, because you're not going to get a lot of frontal plane and transverse plane function if you're just squatting or deadlifting on two legs, right? Doesn't like to work from over here. There we go. Right, and look at all these positions in sport. They don't look a lot like a back squat. They don't look a lot like a bilateral deadlift. They look a lot more like a lateral squat, a single leg deadlift, a single leg squat, or a lunge. And so we have to think about what are we trying to prepare people to do. Now, traditional training approaches, again, sagittal and bilateral in nature, really, really valuable in teaching fundamentals for beginners and teaching baseline strength. Really good for people who don't have a lot of unilateral strength to begin with, people who are just coming in the weight room for the first time. Our middle school program, like kettlebell deadlift and goblet squat, are a staple of everything that they do, right? For our adults too, it's goblet squat and kettlebell deadlift will be a huge part of it. Even for our advanced athletes, we're still trap bar deadlift, everybody that comes in here. Because there is value in developing sagittal plane strength. There is value of pulling a lot of weight off the ground. But there's much less specific carryover to the joint positions and functions that we're going to see for a soccer player, for a hockey player, even for just a middle-aged person who's a recreational runner or someone who's going to go run the marathon on Monday here. Right? Most of their time is going to be spent in a unilateral position, right? Probably better exercise selections from that context, things that are unilateral, highly frontal and transverse plane focused in nature, and just greater carryover to the specific demands of sport or to life. Right? One thing to realize, everything changes on one leg. Lower relative loads, right? Because you're typically not going to put a load on the back. You're going to have less total load if you're on one leg. So typically you can train more frequently, and we'll touch on that in a second. Although global movements in the sagittal plane, look, the only reason he's not falling over is because he uses his adductor and he uses his lateral hip to be able to keep himself square. And as I referenced about coaching, I'm going to go back to that one. Is how we coach these things matter. Again, remember, joint position is really important, because if we're not getting this, where we say pelvis is over the femur, femur is over the tibia, tibia is over the foot, we're probably not getting the multiplanar function that we want. I keep losing the cursor. There we go. Right? So when we look at this guy doing a single leg squat in a second, it's a nice front on view so you can see. I always say nose over toes. I want the nose over the hip, over the knee, over the foot. And by orienting yourself this way, you're lining yourself up in the frontal plane, right? And so for him to do that well, right? Have you ever seen someone who can't do a single leg squat? What happens? They do this, or they do this, because they can't maintain their pelvic position relative to the rest of their body. And so coaching those things really matters, because then you're going to get more carryover and effectiveness in the exercises that you choose. And so everything changes on one leg when it comes to loading. The idea of lower system load is something we've been really attracted to recently. Alex Natera, if anybody's familiar with him, came and did our winter seminar this past year. And so what they did is they looked at relative loading of bilateral back squatting versus true single leg squatting variations, like a single leg squat or a skater squat. And what they find, I mean, we already knew the bilateral deficit was a real thing. Oh, I get to show myself off. Is that we get equal or greater lower body loading with less spinal compression, right? And so what they find is that, I think he did this segmental analysis where 64% of your body weight is above your waist, right? And then the remaining percentage is split between your two legs, right? So if you do a true single leg squat or a skater squat, you have to lift that opposite leg. So then you're lifting, what is it, like 84% of your body weight right there. And if you add external load to that, you're already 1.5 times ahead of doing a 2-leg squat. And so what he found when they looked at force production through the ground, they looked at intersegmental dynamics, they found 50% body weight skater squat, so like this, is generally equal to a 2 times body weight bilateral squat. So if I'm like 225 pounds, if I took 112.5 pounds on a chain and a vest, and I did that, it's relatively, from a force production standpoint, the same, right? With less external load. So what does that tell us, especially for training athletes, where availability and freshness is the thing that we prioritize the most? You ever do a big day of double bodyweight squats? How'd you feel the next 48 hours? Generally tired and sore. You don't generally feel that bad when you have less relative load when you lift. So you can typically get more frequent training sessions in at a higher intensity, right? There's also lower relative risk for injury because you're not shouldering 400, 500 pounds on your back, right? And so when we're thinking about freshness and we're thinking about carryover to sport or to life so people feel good, because the majority of clients who come to see you are probably everyday people, they also want to feel good on the day-to-day. I generally prefer unilateral approaches because you're going to see, like the quote he says, unilateral squats with the same external load per leg produce greater peak vertical ground reaction forces than bilateral squats and higher barbell velocity than bilateral squats alone, right? And so we can get more juice for the squeeze, so to speak. And I'm always looking for efficiency, mainly because time in training is our biggest asset. We never have enough of it. If you're in a sport, a team setting, you never have enough of it. Even here, your best client comes to see you probably twice a week on average, right? Maybe 3 if they're like an all-star. That's probably the average for most people. So being able to prioritize things is important. Furthermore, going one step past strength training into single leg plyometrics, I don't think there's a more valuable tool at our disposal than single leg plyos. There's no other exercise that's going to give us deceleratory, dynamic, eccentric control on landing, high speed contraction concentrically, and elasticity. There's really nothing else you can do that's going to check all those boxes. If someone told me I had to get rid of everything in the program and I had to take one thing, I'd probably take single leg plyos. Because if you're going to reduce the occurrences of injury and use the tool to improve performance, and I'm not sure there's many things that have that much carryover. And when they look at unilateral versus bilateral jumping, they see the same exact things reflected in the research. So from the same study, unilateral plyometric training was more effective increasing both single leg and double leg jumping performance and isometric leg press maximal force and rate of force development when compared to bilateral training. Because we know with the bilateral deficit, you can get greater than 50% effort out of one leg than you can out of two, because we're wired unilaterally. We're unilaterally, contralaterally built creatures, right? That's why we walk an opposite arm, opposite leg. That's why we do reach with one arm, because we're wired that way. And so we can get more juice from the nervous system on one leg than on two. And so when we think about, again, preventing or reducing, I should say, lower body non-contact injuries and improving performance, I don't think there's much more valuable things we have than single leg strength training and single leg plyometrics, right? Again, let's go through the questions. Am I loading the appropriate tissues in a split position, single leg squat, single leg deadlift, whatever it might be, glutes, hamstrings, quads, and then frontal plane, transverse plane muscles, adductors, obliques, glutes? Yes. Appropriate joint positions, single leg stance is essentially what you play sports in, right? Anytime you plant, change directions, take off. Very rarely do we have a true bilateral jump unless we're going straight for a rebound beneath the rim. Specific planes and actions, yes. Sagittal plane power, frontal plane, transverse plane stability, and then the volume and speed and intensity that I want. I mean, you get the highest relative loading relative to your body weight in a single leg exercise, more so than you do in a bilateral. And again, single leg plyometrics for rate of force development. So again, I always think, can I check those boxes? And that's what takes me to where I want to go. And then let's talk about trunk. So core training and trunk focused power training, okay? So how should we look at core training? Again, core training is a buzzword. I tend to like to use the word trunk because we tend to just think of everything here, but everything on both sides is going to be involved in the equation. So again, these are the things a lot of people think about here: rectus abdominis, obliques, transverse abdominis, internal oblique, very valuable, but also pelvic floor, transverse, multifidus, diaphragm, as well as the stuff people forget about the most, posterior trunk muscles, because that's also what's going to help us function to create stability from the inside out. So what do core muscles do? In pretty much everything in sport and in life, they work to help. I like the analogy I heard Mike reference the other day. They're almost like ropes pulling a sail. We're trying to control where the force goes. and move it. They brace and buttress, obviously, your spine and your spinal cord, but they create stiffness and work as eccentric and isometric stabilizers to help produce and transfer force between the lower and upper body, right? Generally, we're producing force with these or these, and this is the thing in the middle that's helping it go from one place to another. So if you think about ropes on a sail, right? If you want to try to move the ship, you either let more out or you pull it tighter to help control where we're going. And that's essentially like what our muscles do. They're typically helping him control his torso as he reaches up to grab the ball, or help pull back down as he pulls the ball back down from a rebound. And again, going back to the diagram that I've shown like 10 times, joint position is going to dictate function. If we're overly lengthened, not going to be very valuable. If we're overly shortened, not going to be very valuable. The muscles on both sides are going to work a lot better when things are relatively aligned with one another, right? And so with that in mind, we're generally going to select exercises that are going to work on challenging that position. So then when we go into sport, you know, if she goes to hit that ball and she's here, not a great way to produce power into the ball. But if you're here, you're able to take the push through your legs, transfer it through your torso, and put it into your hands. So thinking about things that are anti-focused, anti-rotation, anti-extension, like shown on the left, are generally going to have greater levels of carryover to our sporting activities, right? And anti-core training doesn't mean lack of motion. It means controlling motion, right? Obviously, your spine needs to move, right? But generally, by working on controlling it, you get better at moving and controlling it, right? The thing is, people aren't good at controlling it, so the people who are generally weak are really good at crunching and rotating because they don't have the deceleratory function in those muscles in the first place. So we generally look at trying to program anti-extension, anti-flexion, anti-rotation, anti-lateral flexion for that reason, to develop basic movement competency. And it all starts again in the sagittal plane. If you can't control your rib cage and your pelvis here, you're definitely not going to be able to control it here, right? There's no sense in doing an anti-rotation exercise like this because you're not going to use any of this anyways, right? You got to get here. Now I'm a lot more stable in the frontal and transverse plane. So teaching basic anti-extension stuff first, things like ball rollouts, things like planking, things like where you have to understand the front side, tend to have greater carryover to the rotational based things later on, right? From there, then moving to frontal and transverse plane focus, things like anti-rotation and lateral flexion are where we're gonna be the money exercises to have carryover to rotational sports, right? And that's what I wanna take us into now. So typically when you hear people thinking about training for rotational strength and power, the first thing they think they need to do is rotational strength and power exercises, right? But I would say we need to kind of focus on controlling that first. And when we look at what actually happens during rotational sports, rotational strength and power is much less about producing spinal motion and much more about controlling it. And I challenge you to go look at any rotational sport, and I'll go through golf again after this. Very small amounts of disassociation actually happen between the trunk and the hips. I mean, look at Mike Tyson crushing him in the head right here. His hips and his shoulders are together, right? You don't see a big disassociation of his rib cage and his pelvis. Similar here with this home run. Look at the line from his hip all the way up through his shoulder. Generally speaking, these things move together because how else would we produce power to push the things where we need to go, right? If I was here or I was here, it wouldn't be very effective, right? So what we're typically doing is controlling force transfer from the legs to the hands. Heavy impulse with relatively small amounts of motion. And that doesn't mean nothing moves. There is rotation, but being able to control it effectively allows us to put force where we want it to go. Same with golf. Very strong coupling between hip and lumbar rotation in elite golfers. And golfers with limited hip mobility exhibit higher levels of lumbar rotation because their hips don't move. To produce power, you need to be able to rotate your hips. You need internal-external rotation. If you see here with Tiger, the majority of motion doesn't happen in his lumbar spine, does it? It happens in his thoracic spine. So if you look here, his belly button's probably rotated just a little to the right. His T-spine's rotated way to the right. And then as he comes down and impacts through the ball, he's squared up over the top. Most of the motion happens T-spine extension rotation and side bending. That's why thoracic mobility is so important. Because if they can't side bend their T-spine and rotate their T-spine, and they can't rotate their hips, there's only one place they're going to try to make it up. And that's generally the same people who have higher levels of reported back pain and lumbar stiffness because their hips don't move, right? So again, this is a good example. I saw this video pop up and I screen recorded it because he gets so much thoracic disassociation, but his trunk and lower lumbar and hips stay pretty still. The money in being able to produce power is keeping it stiff here and being able to rotate your T-spine. And I think this video goes quick, so watch it. But look at his huge thoracic disassociation, comes down square through the ball, huge amount of side bending, right? But the ability to be able to control that so that you can put the force in the ball is how we produce power. And so that's why we go by that old joint by joint approach. It still holds true. Most people need more thoracic side bending, need more thoracic rotation, need more stability through the trunk. All right, so that's why things like this don't generally have much carryover, right? Because we typically function, it's either that or it's the leg twisty one, right? Where they're trying to drive rotation in the lumbar spine, probably not that much carryover. So for me, when I think about how do I make someone powerful and strong in rotation, which is the money in all sports, right? Throwing a baseball, hitting a golf club, throwing a punch, everything's gonna be rotational based. Develop sagittal plane trunk strength first, then develop transverse frontal plane strength, then move towards transverse and frontal plane power, right? That power is going to be laid on top of those things as a foundation, right? So maybe that means when I say sagittal plane trunk strength, I mean things like ball rollouts, where we're teaching them how to control the relative positions of their rib cage and their pelvis. Then moving towards transverse plane strength, think something like a side plank, right? Side plank progression. Now, that side bend, when you see that guy rotate through, his ability to control that is very dependent on his ability to have transverse plane strength in his rib cage and his pelvis, right? Then moving towards anti-rotation things, whether it's active isometric rotation, where you're creating the force, right, like this, which would be a little bit different than me doing something like this, where I'm resisting the force. Generally, with most of my athletes, I'll do both. I'll have them think about producing force isometrically and resisting force isometrically. So they're getting both of those sensations, because when you swing, you're going to produce force isometrically in the rotational or transverse plane, but you're also going to resist it on the opposite side. And so I tend to have them focus on both, right? Things like push-pull, that's an old one. Look at the lineup there. Things like chop and lift. Right? And so that's how I think developing basic trunk strength to have carryover to a lot of these sporting activities we care about is where we need to focus. And then from there, developing power on top of that, okay? Thinking about like he's a pitcher, so I was like, well, let's just practice throwing from the stretch, right? And being able to teach him how to rapidly couple that hip rotation, pelvic rotation, trunk rotation over that hip. And again, that doesn't mean I'm the no fun guy. Like, so people always hear functional training means, okay, oh, like that, people still want to do arms. No one said you can't do those things. I'm not saying you have to get rid of them. They're not going to make you worse. But only focusing on the dessert all the time probably isn't going to get you where you need to do, right? I like curls just as much, probably more than the next guy. Not more than Bruce. I don't like them more than Bruce. That doesn't mean these things are bad, right? Okay? And so I think sometimes when people hear that message, they pollute it by you saying like, oh, you're the guy that doesn't like fun. You can do all of these things, but understand if you have a stated goal of improving your sport or having your back feel better or moving better through daily life, these might not be the best selections to get you to where you need to go. That doesn't mean you can't do them. You probably just need to do other things as well. And so programs should be fun. I want people to come in and feel good about themselves and train their arms. I want them to do if you go on a machine and do some exercises, you're not going to fall apart and like break. But you just can't live on those things all the time if that's what the client's goal is. Now, if you're training someone for a physique show, if you're training a power lifter or a strongman, those might be much better choices. That is probably the definition of functional training. But what I defined here is what is probably functional training for all of you in the clientele that you see. And the majority of trainers out there, very honestly, because what you see on social media or online is typically the things on the fringes. And we're typically operating within the lines somewhere in between, right? So again, the answer is the thing that frustrates everyone. It depends. You have to go back to what your client's goals are. And it goes back to having a conversation about how they want to feel, the things they want to be better at, the things that they want to perform, and then building your program backwards. And thankfully for us, if you have a very similar clientele to us, that's how our program translates very well to all of you, because our avatar of average client is probably very similar to yours, right? So going back to these questions, when you build a program, audit yourself and say, am I doing all the things am I selecting the exercises that have the greatest carryover for my client? And if you can say that, then you're probably going to be in a really good place, okay? I got through that pretty quickly because I knew I was up against the clock. So that's my contact information. If you wanted more information, it's on Instagram. Most of my training stuff's at Movement is Medicine, as well as on MBSC TV, strengthcoach.com, and certifiedfsc.com. And my book's on Amazon or Human Kinetics if you're interested in more. I think I have a few copies stashed in my office too, if anybody wants any. So, thank you guys. Yeah.